Hello, everyone, and welcome back to Clinically Speaking, Ivy Rehab's live LinkedIn series where we explore the topics shaping clinical care, professional growth, and the future of rehab therapy. I'm your host, Biz Marie, and today we're talking all things dry needling, what it is, why it matters, and how it fits into physical therapist treatment toolkit. From regulatory complexities to clinical applications and patient impact, we'll cover it all with an incredible panel of Ivy Rehab leaders and clinicians. We have Halsey, a physical therapist and leader on Ivy's clinical excellence team, who brings over 11 years of experience in education, compliance, and clinical mentorship. Vincent Ceriale from Ivy Rehab King of Prussia, PA, a clinician passionate about helping athletes and a certified dry needling specialist. Dr. Andrew Lotocki, clinical director at Ivy Rehab West Deptford, New Jersey, with a strong background in orthopedics, sports medicine, and advanced manual therapy techniques. We're excited to break down all the facts, share real experiences, and explore how Ivy empowers clinicians to advance their skills, all while keeping compliance, education, and patient care in the heart of what we do. So let's dive in. So, Kara, for listeners newer to the concept, what exactly is dry needling? When did it take off, and what does it treat?
Yes, thank you, Biz. I'm excited to be here. So, hi to everyone listening. To start us off and go basic, dry needling is a skilled intervention or a technique that physical therapists and other healthcare providers, such as chiropractors, use, and it involves inserting a thin, solid filament needle that is dry, and that means that it just doesn't have medication or we're not injecting anything into the tissue. And we insert that into muscles, muscle tissue, things like trigger points, fascial restrictions, all throughout the body. The aim of dry needling is to reduce pain, improve mobility, and restore function. And to get a little bit into the history, because I think it's so interesting, and ensure that listeners know that I'm definitely not a dry needling historian, but I have a lot of experience in the regulatory and compliance area of dry needling, and I've done a lot of research, and it's interesting to see and hear how dry needling did emerge in healthcare. So it's been around since the 1930s or 40s when physicians started testing out injecting wet needles or the regular hypodermic needles that you see with medication into things like muscle tissue or those trigger points that we were talking about, and they saw that it did relieve pain. And then into the 1970s or a couple decades later, physicians started trialing that same technique with a dry needle. So that is what we call dry needling today. They found that it also relieved pain. So we look at dry needling through the Western medicine lens, through Western medicine principles, specifically neuroanatomy and musculoskeletal science. And we basically use or target specific dysfunctions, use dry needling with our evidence-based clinical reasoning skills and our physical therapy diagnosis, differential diagnosis, and use it as part of our treatment. And one of the tools that we provide to our patients when we look at them from a holistic perspective, and we incorporate dry needling into our plans of care.
Thank you, Kara. I like that little history lesson there to give us a background on, when it started, because you wouldn't think that it started so many years ago. So it's interesting to hear about. And we know that dry needling has been known to be a hot button topic. So I would love to hear, why is that the case?
So that's a great question. And I think it's fair to start off with saying that there can be hot button topics in healthcare and tension in healthcare, and that stems from scope of practice debates between professions. And I think it's, when you really think about it, I think that's healthy. So healthcare providers have an ethical requirement to do no harm and to practice within a specific scope or within competency parameters or specific limitations. And that is to protect the public. We want that. That is part of healthcare. But as providers, we also have to ensure and we want to ensure that we're providing comprehensive, evidence-based, the total package treatment to the patients that we see. Ultimately, we want to reach our patients' goals. That's the end of the day. That's our goal. That's the patient's goal. We want to get them where they want to go. And sometimes that's pain relief and sometimes that's not. But when it comes to these types of tension or hot button topics, it does happen throughout the healthcare industry. And I thought I would talk about like an example for the audience that's non-physical therapy related. So a scope of practice, debate might be nurse practitioners and the type of oversight that they need. So do they need to be directly overseen by a physician, or how many nurse practitioners can physicians oversee? It varies by state to state. It has been a debate throughout the years. And it makes a lot of sense, right? Like nurse practitioners are competent healthcare providers, and so are our physicians. And where do we draw the line on what type of oversight do they need, and what do state boards think? Throughout the country, everyone has different opinions. So it's really common. And I think I wanted to just bring that to light, that when we talk about a hot topic like dry needling, it's sort of great that we have this debate and that we can have this awesome tool and be advocating for ultimately helping the patient and also ultimately keeping the public safe. So in regards to specific dry needling, the controversy or the debate is that some groups argue that only practitioners trained in acupuncture should be allowed to use needles. But then the counter argument to that is that dry needling is not acupuncture in the eyes of physical therapists. It's actually grounded in Western musculoskeletal science and not Chinese medicine. We don't follow the meridian guidelines that acupuncture traditionally does. We look at it from an anatomical differential diagnosis perspective. And we're super excited to undergo additional training, post licensure, post entry level board certification, to ensure that we are providing safe and effective dry needling treatment. So that's why it's a hot button topic. But I think just to close that loop, the really important thing I want listeners to understand is that it really is more about protecting patient access to care. So research supports dry needling and its effectiveness, especially when it's combined with other manual therapy techniques that we provide, exercise prescription that physical therapists provide. So it is a powerful tool, and we have to make sure and advocate for that tool to be provided to our patients. And I'm sure we'll get into this discussion in a couple other of the questions that we're going to talk about. But physical therapy is a really important piece to the opioid crisis. And if we lose access to treatment that we believe is going to ultimately help our patients and get them to their end goals, we are afraid, and there's a potential that they will seek out other treatments. And when we have something that's super effective, cost effective, and a better option than going down the opioid prescription road. And I'm sure we'll talk about that a little bit later, but that is really what it's all about. That's what we do as healthcare providers, is we advocate for our profession and things that we truly believe are within the scope of our practice.
Thank you, Kara. And I do want to ask Andrew and Vince, do you have anything you want to add to that question of dry needling being a hot button topic? Are there any thoughts that you were thinking of as Kara was answering?
Yeah, I think to echo Kara's point, like there definitely is a big difference between acupuncture and dry needling. So to get the education out there to patients that these are different, treatments, and that we have this in our toolkit is extremely important. And because it's so controversial right now and also not as well known, that educating the patients is a very important thing that we can do as clinicians.
Yeah, I would agree with all those pieces. It was fantastic. And another, even clinicians, advocating to clinicians to say this is an additional treatment option, again, with the appropriate training, that's now part of our scope of practice as clinicians, that it is differing in the sense from, traditional Chinese medicine and acupuncture, and it is heavily based in evidence medicine, and current concepts that are now being, rigorously studied to the effectiveness of it, and we're seeing positive outcomes with it. So, as Kara had mentioned, it's an additional modality that we can utilize as clinicians to help patients, to give them the best treatment options possible.
Thank you both so much. Oh.
I think you bring up really good points. So Vincent and Andrew both came at that confusion piece. So confusion from patients, not really understanding what dry needling is, almost like there's an assumption because a lot of people are aware of acupuncture. And so that's where like a lot of the confusion comes in. And Andrew brought up the fact that even clinicians, our own profession, there is confusion around it too, because of the controversy or the we weren't allowed to do it for so long, or now we're doing it. So it's really interesting. And I do think they bring up a good point that is probably why it's a hot topic as well, because there's confusion around it. And so that is, I think, we're on a crusade, and I have definitely been part of this, to clear that up and to provide education to the public as well as in our industry to clinicians. So thanks for bringing those 2 points up.
And I think this is a great segue into the next question, because Kara, when New Jersey passed dry needling approval for PTs back in 2021, you were right in the middle of it. So can you walk us through what that moment meant for you and Ivy? And Andrew, I would love for you to chime into this as well.
Yeah, I think Andrew will agree with me. It was a huge win. It was a win for our clinicians. It was a win for the profession. And most importantly, our patients in New Jersey. So we currently operate about 151 clinics in New Jersey. So we have a large footprint in that state. That's a lot of clinicians and a lot of patients that we are treating on a daily basis and, ultimately improving their quality of life. So I think it's important to talk about New Jersey today, because that was the most recent kind of big undertaking that we took at Ivy, and Andrew is a clinician in New Jersey. So again, a nice little history lesson. I love these fun facts, but PTs in New Jersey have been advocating for years to include dry needling in their scope. And from about 2009 to 2017, it was gray, and there were definitely clinicians who were providing that treatment. And when I say gray, like the legal term of gray is just that the status of providing dry needling was unclear. It wasn't explicitly defined in any of our rules or regulations in our practice acts, or it could be actively under dispute. And so New Jersey was gray for a time period there. And more confusion comes in when there's gray. There are administrative rulings, there are different opinions, there are lots of things coming out, but that are not strict law or guidelines. So therapists can be trained and they can be capable of doing dry needling, which was happening in New Jersey for that time period, but they're unsure if they should provide it, or they're at an increased liability if they're providing it in a gray state. They're not sure if they're following the guidance, the opinions, the insurers. So it just increases liability and risk, and it doesn't really build confidence, in the public. So in 2017, it did come out through a bill. A bill was passed to restrict the treatment. So there were letters, and I'm excited to pass this to Andrew and get his experience, but there were letters sent out to PT providers in New Jersey notifying them that after September 1st of 2017, dry needling can no longer be provided to their patients in New Jersey. So they took a hard line, and it just kind of worried everyone. It was a pretty... It was a double-edged sword, because you're happy that you're getting guidance, right? We don't want to operate in gray. You're happy that you're getting the guidance, but you're not happy that now these patients have to find alternative ways to manage their pain. And that, kind of takes us back to opioid potential prescriptions. And so I think at that point, it was... it didn't end for us. There was a long fight, and you could say for 5 years, it was a fight for physical therapists, and our association, the American Physical Therapy Association, and lots of other, entities did try and fight for the reversal of that bill. And it came in June 2021. And then in January 2022, it was implemented. So that was the win. It was a real validation for us. And for Ivy, it meant that our New Jersey clinicians could now offer the same evidence-based interventions that other Ivy clinicians were offering in other states that we operate in. So I think it was just overall such a long time coming and such a great win. We immediately, and I'll speak to this a little bit later, I want to let Andrew talk to his experience, but we immediately like latched onto this. We looked at the bill. We read, the rules and regulations. We tried to understand what was required. What did we need to do to roll out training pathways, to be safe, to make sure everybody was credentialed and certified, and our patients and our clinicians felt confident moving forward into it. So it happened. It was a big win. Like, yay, let's celebrate. But then there was some real work to be done. And we can talk about that like in the next couple of questions. But Andrew, I'd love to hear about your experience.
No, that was a great summation of kind of what New Jersey, the challenges we went through. So during that time period, it was very much a gray area with dry needling in our scope of practice. But at that time, there was a very hard line drawn as it was dropped from the New Jersey State Practice Act. And your memory probably serves better than mine, but I believe it was in the fall of that year that they said, past this point in time, patients will no longer be allowed to receive, intradermal treatments, dry needling treatments, because it is no longer in the scope of practice of New Jersey clinicians. So we fought hard for it. We lobbied hard, but as these things, they take time. Changing the sort of verbiage and vernacular in state practice acts takes a lot of effort from a lot of different sides. And so, as you said, it was a very big victory for the state of New Jersey. But during that time, going as a state who was able to practice to then no longer being able to practice dry needling created challenges in the surrounding states. There was also a gray area with Pennsylvania, and Delaware was pretty much the closest we could send patients if they were interested in this treatment modality. So it became a challenge to care for our patients and find them appropriate treatment options. So as you said, a big victory came for us when it was reinstated back into the New Jersey State Practice Act. With it came a little more clarity, but also stringency in how we now operate with dry needling. And so the oversight in which we now operate requires a bit more in terms of didactic and lab practical time for clinicians in order to practice. And with that, maintaining that certification in a 2-year cycle. So it came with very much a successful component to it, but also now we have a little more stringency in how the clinicians are able to practice dry needling, which again, I think is also a win for us. Like you said, coming from an area of a little more uncertainty and gray area to now more concrete practice act and how we can apply this treatment modality has allowed us to not only, get more on board with the use of dry needling, but be more upfront with clinicians and patients on, the background education and how we can use it.
It really instills confidence in our patients and the community around like what PTs are capable of and what we have in our toolbox and just being, a competent provider to be able to provide that. So I think it was really important for that. But can I follow up with you, Andrew, on that? Like, do you remember what it felt like to have patients on your caseload that might have been receiving dry needling, and then to have to think about September 1st, I have to remove this from my plan of care? It takes away a bit of autonomy. I'm just kind of walk me through like how you felt.
Yeah, very unique time leading up to it. We did have some lag time. So as clinicians practicing it, we knew that there was a hard stop to this, treatment modality. So we gave patients a fair enough, head start to let them know. But at the same time, a lot of patients were advocates of this treatment and had very good outcomes with this treatment in combination with other hands-on modalities and exercise therapies. So to pull that away, it was a challenging aspect to be a clinician during that time, to say, this is a treatment you have, and it's almost like operating, say as a carpenter, but you're not allowed to use a hammer, right? Or operating as somebody, and they're taking a tool away from you. Now you can use other aspects, obviously, we got creative, and it's not the only way you can treat a patient, but for those that it was working for and having success with, it was a challenging time to then, essentially hard stop that treatment modality. So.
I love that analogy. Thank you. Thank you for using that. And I would like to make the point to emphasize that when we talk about dry needling today, it really is a tool in our toolbox. And when, as physical therapists on this call, I mean, we look at our caseloads, however many people for ease of use, let's say we have 30 people on our caseload, there could be at different times as high as 20 people getting it and as low as 1 to 2 people getting it. It really depends on patient presentation and what our clinical reasoning says and what we determine is appropriate for the plan of care. So I do want to make that point that dry needling is not the treatment for every single patient and the only treatment. It is just one component. I just think it's an interesting component, and that's why we're talking about it today.
And Andrew, I have a question. When you were going through that process, how was it like having to speak to the patients who were currently going with, through that treatment and having to let them know that they were no longer able to?
It was interesting. It was met with, I would say, a lot of disbelief that it was being pulled away. Patients, were, I would say, as big advocates as we were as clinicians, they were as patients, because they saw, improved outcomes with a lot of the techniques and the rationale for why we use it, which we'll dive into probably shortly. So to have those conversations with, a fair amount of patients during that time period to say, unfortunately, this no longer is a treatment we can legally administer in the state of New Jersey. These are the options we now can offer you. Unfortunately, you need to drive to Delaware, which I'm in southern New Jersey, which for me, could be anywhere from, 45 minutes to an hour. But it's challenging because patients now look at that as, well, that's a barrier to, potential, or a roadblock to potentially seeing a successful outcome based on what I was previously getting. So it definitely at that time was a unique set of circumstances that posed some interesting challenges for us.
Oh, thank you for sharing. And before we continue talking about New Jersey, because I know that we're going to stick to that state for a bit, I do want to ask Vince, because, Andrew, you mentioned Pennsylvania is another great state. So Vince, can you kind of talk to us a little bit about your experience working and practicing in Pennsylvania?
Yeah, definitely. I think it's interesting because I signed up for all the dry needling courses because I thought they were really fun and different. So I just wanted to expand my toolkit, and we weren't allowed to do it for a time. So I had training under my belt for a good 6 to 8 months.
Oh, did we lose him?
Oh no, I think so.
Oh no. All right, he's probably going to come back and. Oh. You know what? I'll tell the listeners. Vince and I are in PA, and there are major storms going on. So let us pray he did not just lose his power. So.
All right, so we'll come back to you, Vince. No worries. So then we'll stick with New Jersey for the time being. So, we've covered it so much. So I really want to ask, why is New Jersey so important? Why are we really focusing on that particular state?
I think just for the, the effort it took to get this back in our State Practice Act, it really does show the resilience of our profession. It shows the hard work and effort a lot of folks did behind the scenes to really push this as a treatment option for patients. And I think at the center of it, it really does have the patient in mind for this treatment, option. And as Kara pointed out, it does differ in a lot of ways from the traditional Chinese medicine approach. And that was the verbiage and the efforts that New Jersey made to try and make those points to the State Practice Act and to get it back, as a legal treatment option. Was we're using evidence and a more musculoskeletal neurodynamic models in order to administer this, and not the traditional Chinese medicine and meridian line methods that have been used in Eastern medicine for thousands of years with much success. But it's a different treatment-based model. And so I think those things combined with the fact that we met some resistance from other health professionals, and as Kara pointed out, there's always a healthy dynamic tension, we'll call it, between healthcare professionals and who offers what. So when that was, a hot button topic and debatable about intradermal and intramuscular treatments, and how physical therapists, that's not something you guys offer. You are the musculoskeletal experts and movement specialists, and you use your hands, but you don't put anything through the skin. And I think it's you really have to commend the folks that put forth a tremendous amount of effort to get this back in the New Jersey State Practice Act. And as Kara said, just with Ivy alone, I mean, the number of clinics and clinicians we have in New Jersey really is a testament to those who have gone through this coursework and are really utilizing this treatment modality to help patients. I think you have the numbers, but upwards of 150 plus clinics and clinicians, abound. So it really is something that for New Jersey, it was a massive win when we were able to get that treatment option back in our toolbox, so to speak.
I'll just add, and then we can maybe go back to Vince if you want, Biz. But
yeah, sorry.
That's okay.
It's like storming really bad here. And
yeah, I told everybody we're both in PA.
Yeah, it's so bad here. Sorry.
No, it's okay.
I'll just add to Andrew's answer, just because I do have some numbers, but what we're seeing today is also a really big victory across all states. We have 39 states, or about 75% of the US, allowing dry needling. And that's huge. It has not always been that high of a number. And the reason we're focusing on New Jersey is because we've had all this experience now. Like I said, it was a victory when they passed the law, and we felt, very empowered to provide this to our patients. But there was a whole lot of work to be done to make sure that we were doing it in a compliant manner, that our clinicians understood the education requirements, that we understood the safety requirements, all the way down to as specific as how we're supposed to dispose of these needles. There's so much work and I think it's why I love my job. I mean, this is what Ivy invests in. You are supported by a team like me and my team members, the clinical excellence team, to get you through something like that. So one big question, and I'd love to get the clinician's perspective on this, one big question and one big barrier for providing this treatment is that clinicians don't really know how to go about getting credentialed or to become a provider. The rules and regulations are so different in every single state, and they hear things like gray state, limited state, not allowed, all those things. So they're just not sure how to move forward. And I think that's why we picked New Jersey, because now myself and my team have so much experience on rolling it out to the company and ensuring that we were partnering with the right providers, that we were, in compliance with exactly what New Jersey wanted, interpreting the law, which we all know is not always easy. So just making sure that we were doing everything right and ultimately getting this modality to patients when they needed it, where they needed it, in a safe manner. So that's why we picked New Jersey to talk about.
Thank you, Kara. And then I do want to bring it back to Vince so that you can touch on your experience in Pennsylvania being a gray state as well.
Yes. Hopefully I don't cut it again. I'm sorry about that. So when I first got credentialed, I actually wasn't allowed to do it in PA because it was so new and because Ivy didn't quite have the policies in PA because it was gray. So, and I got credentialed in New Jersey just because I thought it was a really cool and really innovative way to treat. And I was like, this is great. And like, I hope this comes to PA eventually, which it did. So we kind of had to start from the ground up, and we had to adopt a lot of policies, and we actually had to write some of our own script for dry needling to be able to perform it in PA under the umbrella of Ivy. So I can't thank Ivy enough because it was so new and like so, I guess, like in development in the area. And when I heard patients were being sent to Andrew's point, like to Delaware to get dry needling done, or to Jersey, I was like, that's crazy. Like, you know, we have plenty of very competent clinicians that would be very happy to do this, but that gray area definitely casts a shadow on, like, you know, what we can do and what we can't. So now that, you know, Ivy has some policies that are really strict for allowing clinicians to perform this, it's great. Like, I think it's a really nice avenue of treatment for patients to be able to get it. And I would say 99% of patients who I mentioned dry needling to say like, oh, like, is it like acupuncture? And I'm like, no. So I have to go through my whole spiel. So there's been a lot of different challenges, but it's been good for me as like a treating clinician to kind of get my verbiage down, as well as just, you know, really bring out that education piece. So I think the barriers are more like stepping stones to allow like future clinicians to, you know, kind of get that education piece under their belt too. So that's, I think, really important, especially for like the future of all the gray states, and even New Jersey, and even like our clinical practice guidelines of like doing more research to facilitate more treatment methods as well. So.
Last thing I'll add to that, Biz, because that's such a great point, Vince. For any clinicians who are listening and you operate in a gray state, he brings up a great point. Make sure that you're operating with very specific clinical policies, and just make sure that you are in communication with your administrative staff and, you know, leaders to reduce that risk. And I think it's so important.
Thank you, Vincent. Thank you for adding that, Kara. And then kind of jumping into why dry needling matters in the industry, I want to ask, why is it so important for physical therapists to have access to dry needling as their treatment toolbox, and how does it support patient care?
That's a great question. I mean, I think as a clinician, you know, just having, you know, all the necessary resources, you know, just to treat patients in different avenues is beneficial. So whether that be, you know, hands-on manual skills or, you know, background in different techniques, you know, dry needling is similar to that effect, where it's another treatment modality that with the proper training and use of it can be a very helpful tool in the you know, a treatment and evolution of patients. So, you know, as a standalone treatment, I often tell, you know, clinicians and patients, very rarely will I use it as a standalone treatment. It's you know, almost always used in conjunction with other therapies, hands-on manual therapies, therapeutic exercises, neurodynamic movements. But with that, it can be a, you know, accelerant in the patient's you know, recovery process.
Thank you, Andrew. And Vince and Kara, do you have anything you want to add?
Yeah, I just want to echo what Andrew said. Like, I think just having that extra skill is really important, and being able to cite some new evidence that's coming out also helps like patients to understand, like, you know, this is something that can really help me to get, you know, that last little bit of percentage that I need to really reach my full potential for healing. So I've had a lot of patients that have kind of been almost like stuck on that like last like 80, 85% or so. So this really helps to kind of push them along. And I completely agree with Andrew. Like, dry needling is definitely not a standalone treatment, just because I think as physical therapists, we should be implementing all of those different types of care that we have. But this is just like another important kit or another piece in our toolbox. So.
Now that's great. And oh, sorry, go ahead, Kara.
No, I was just going to say, yeah, they basically said said what I would say, and I did bring up in previous questions that opioid crisis and just being a part. So from a global perspective, being a part of that solution, and really from every angle, we want to ultimately provide the best possible care that we can to our patients. And I'll bring back that example of, like, even if my caseload is 30 people and I'm only using dry needling for one of them or two of them, that is just as important as all the modalities I'm using on the other, 29 patients that I have on my caseload. That's where I think I want clinicians and patients to understand this take on dry needling, is that it definitely isn't the end all be all, or even a modality that they use standalone, but it is so important that we have it in our toolbox and that every single patient gets what they need to get them to their goals.
Thank you, Kara. And I did want to mention, just talking about the continuing education aspect of it all. And that's something that really makes Ivy stand out as a company, is how important that is for our teammates. And I know we're going to touch upon that a little bit more, but I wanted to emphasize that now because it's something that's really exciting for any clinician that comes on. So, Kara, I know you've mentioned that you've been a patient of dry needling yourself. I would love to hear about what that experience was like and how that shaped your view as a clinician.
Yes. So I think I had a very similar experience to Vince. So I would love to speak to mine and then kick it over to Vince. But I, as a clinician, felt in a time in my life that I needed dry needling as an adjunct to my therapy. I was doing therapy for cervicogenic headaches, and I felt that this was a modality that could be added, that could give me relief. And I remember vividly going through my treatment, like, rehabbing myself a little bit, rehabbing with my friends a little bit, getting that dry needling and saying to myself, it did help. It did help relieve my symptoms. I am in a really good place, functionally, and after my whole bout of therapy. What if I didn't know about it? Like, what if I didn't know about it? Not many patients do. Patients don't know how to rehab themselves. That's why they're here to see us. And I felt as though I was lucky to kind of create that myself. And I'll tell you, I had to go, to a specific person who did dry needling and then another person who did. So there was a lot of coordinating of care. And I'm a therapist. And I just felt to myself, I was like, this needs to be, more publicly known, that they need to understand that this is an option, and the therapist, any patient out there, a therapist should be able to guide you right there in that facility with everything they have at their fingertips. I hate the thought of saying, okay, come to me, but then go to Delaware for this tool. It's really tough to wrap my brain around that. And that was my experience. So would love to hear yours, Vince.
Yeah, I think that's a really good point. Like, if you can experience it for yourself, it makes you that much more impressionable on your patients to know that it worked. So I know for me, because I also have cervicogenic headaches, when I had my first couple treatments, I would get headaches for like days. Like, it would be like every day I would have a headache and I would just deal with it, and it would be terrible. But you just kind of get used to it. And you fall into that rut of like, okay, I'm just getting used to this pain. But after having like a couple of the treatments, I was like, oh my God, this actually is great. Like, this is working really well. So to kind of bridge that gap from like, I'm a treating clinician to my patients who are receiving the same type of care, it just makes it so much more like meaningful, because you're like, this is going to work, and you have a really good chance to recover for this. Especially if conservative treatments don't. And I think that's like very, very important, because patients are like, oh, like it really worked for you. Like, let's at least give it a try. And, just giving it a try and just learning about it. And even like, if they have a family friend or somebody else who has similar symptoms, they could be like, oh, well, I can tell this person about it. And that can, help to get the word out, just especially if people aren't educated about it. So, yeah.
It definitely seems like it helps establish trust as well. Once you can really tell from personal experience, and the patient will feel much better about their decision to taking on the treatment. So I think that's great. Thank you for both your points. And then what makes dry needling effective, and when do you think it's most appropriate to incorporate into treatment?
It's a broad question, but I'll try my best to answer it.
We have 2 hours.
So the scope of which it can be used is it's great in the sense that it can treat a varying patient population. So anything from local trigger points in, say, your calf or your plantar fascia, all the way to fibromyalgia and systemic chronic pain conditions. The basis behind which dry needling can be used has, again, different evidence-based approaches. So you can look at it from a local, from a systemic, from a segmental approach. So to give you a quick breakdown, so it could be something in terms of the patient has neck pain with radiating pain going down their arm. So you may start with targeting tissues in the upper back and neck. You may also go down the vertebrae and the areas in which the nerve roots exit. So you may go at the segmental level of the neck and then work your way out down the arm. So it's to try and answer your question in terms of what patients benefited from the most. I feel like it can vary. It can go from anything from weekend warrior. I have a quad strain to I've had cervicogenic headaches for 5 years. And the muscles of my suboccipital are tight and restrictive. So, but with that, it's knowing and having those conversations with the patients on who may potentially benefit. So from a clinician standpoint, everyone who walks in the door isn't necessarily a candidate for getting dry needling. So it's definitely a conversation with each patient. It's definitely a case-by-case basis with each patient. And even those who I have the conversation with who say, oh, dry needling sounds interesting, but needling is for me, then we move on. So it's definitely not a force-fed modality that everyone comes in and gets the same scripted approach. It's, okay, this condition, dry needling is an option. Let me go through the process of what it looks like. And most oftentimes I'm actually, modeling and showing it on myself. I'll do it on my arm or on my, my hand. And I think a lot of times it shows the patient, oh, okay, you said needles. That's the needle. It's this thin filament, needle. And they come in different sizes, of course. But the treatment parameters and based on the training, you're very safe in these areas you treat. So I just mentioned the cervical and the thoracic areas. These areas, the training that you get, it gives you a detailed background on the anatomy and the physiology of where you're putting these needles and what to expect. And so you're giving the education to the patient with that, saying, okay, I know that we put a needle here. These are the expected results of what you may feel or what you may have 24, 48 hours from now. So a lot of times that lowers the maybe heightened expectation of you saying, hey, let me put some needles in you. When you explain sort of the physiological and sort of neurophysical effects of what happens, then the education kind of shines through and patients are more apt to be like, okay, this is something I want to consider. So.
Thank you, Andrew. And then Kara and Vince, did you have anything you wanted to add?
Take it, Vince.
Yeah, I was going to say, I completely agree with Andrew's perspective on everything. Like, I think it can be applied to different body parts, but I agree. Like, I don't think it's completely applicable to everybody, because at the end of the day, like, patients are trying to seek that autonomy, like that they want to try to, get better and make it seem like they're getting better on their own, and also get the tools that they can use to allow them to preserve their function throughout, life, at least until something goes not great, and then they elect to come back. But I think that dry needling can be applicable to different body parts, and then that education piece comes into play when patients ask, like, can we try needling here? And most of the times the answer is yes. But the other piece of it is understanding, like, how can we make sure that this patient is appropriate. So there are different tests that we can do to make sure that a patient would be a candidate for it, as well as go through our our questionnaire of like, like, do you have X, Y, and Z conditions, and like, are you okay with the needling? Because if I have a patient who wants to try it, but they're afraid of needles, then that might not be something that's appropriate for the patient. So I think you can use it as at a wide variety and a broad scope. But again, like, it's just another tool in our toolbox. So I think that it's got its variability. I definitely enjoy using it in areas that are a little bit slower to heal. Like, I found, like, at least like a specific example is some rotator cuff tendinopathies, or even like a tennis elbow tendinopathy, that are just like really slow, or patients may just keep overdoing it. Those areas of treatment are spots that, especially for a patient who's been coming to me for a little while and really kind of reaching a plateau, like I'll bring it up and just say like, hey, like, this might be something that we consider, and we'll do a separate evaluation for you to make sure that you're a candidate, and kind of just like plant the seed almost. So just making sure that they're comfortable with it before I'm kind of like, like, all right, let's do this kind of thing. So
Great answers. I have nothing to add. I just figured I would tell Biz Marie, in the PT world, we really like the answer, it depends. So that's how I was going to answer your question. I was just going to leave it at that. But you guys answered it way better.
I love to hear the emphasis on patient care, though, like just hearing about how important patient reassurance is and making sure that the patient is comfortable and fully educated is so important. And as someone who was once a patient as well from PT, that's what really helps you stand out as a clinician, when you really show how much you care for your patient and their well-being. So that's phenomenal to hear across the board. And I know we briefly touched upon this, but I want to hear more on, how do you explain dry needling both to a patient and also a curious clinician learning it for the first time?
Yeah. So if I'm explaining to a patient, a lot of times I'll break out the needles and I'll say, this is what we're looking at. It's a thin filament needle. It's housed in a thin filament tube. Most oftentimes when the needle is going to be going in, most times patients feel more the pressure of the tube than the needle itself going into the skin. A lot of times I'll actually demonstrate on myself. But what I often say is, we're using the body's natural defenses to try and help this, whatever it is, whether it's a trigger point or, an ailment or, neurodynamic or neurogenic pain. But essentially when the needle goes in, it's creating a small lesion or micro lesion. And the body then is trying to repair that lesion. And so what it will often do is it will send different anti-inflammatory and endogenous opioids to the site to allow that small little micro lesion to heal. And so I'll explain that to patients to say, essentially, we're creating a small little cut on the inside of your body. We're going through layers of soft tissue, dermis, skin, muscle. And the benefit is your body is then trying to use the healing properties it has to, advance or heal this area in a quicker format. So, have yourself, Vince.
Yeah, I'm pretty much the same way. Like I just say, like, we're trying to improve localized blood flow to the area, as well as potentially have like a systematic effect, like especially for patients that are kind of stuck in that chronic pain cycle. Just the feeling of their body like connecting with their brain and really, I guess, just like, almost like feeling like an internal change might be huge for the patient that's had back pain for years and years and years. Like, and especially for, that same patient who may have been in physical therapy for years and years, like this just offers like a different type of approach that may be more like sympathetic, and also, getting those endogenous opioids to work, or like endorphins and everything of that sort to work a little bit better for them. So just something a little bit different.
Yeah, agreed. And if I'm speaking to a clinician, a lot of times I'll use a similar treatment approach or educational approach, but saying that essentially, depending on how we're applying the dry needling, whether it's a local or a systemic or segmental approach, kind of as Vince said, we're using the body and we're releasing a lot of these, what I call dose chemicals, the dopamine, oxytocin, serotonin, endorphins. These things are going to be a helpful component to the healing process. So where we stick the needles. Now the dosage also matters. So when we talk about dosage, the equivalent would be, 1 Advil can have an effect versus 3 Advil can have more of an effect. So same thing goes with dry needling. So, a few needles to a certain specific site can have some effects versus multiple needles. And then as we get further down into it, you can have needle manipulation. So you can actually move the needle up and down, right? So you can have kind of this pistoning effect that can create multiple small micro lesions in the area. So as Vince said, problematic areas like lateral, elbow tendinopathy or, Achilles or calf, gastroc issues sometimes will benefit from a smaller amount of needles, but the more sort of repetitive, pistoning of the needle. You can also use additional modalities with it. So there's some patients where I will hook up, NMES, so, or TENS unit to it, and we'll apply this, pulse through the needle into the muscle. So it's kind of amplifying or increasing the dosage with the needles. So I tell folks it's kind of like your prescription medication is now that's kind of the higher level of dosage we're using. And that may come into effect again with folks who've had maybe, persistent low back pain, or we're targeting deeper muscles, muscles of the multifidi or piriformis that have been, more adherent or persistent pain by adding that level of increased sort of muscle pump or oxygenation. It's kind of relieving some of the tissue tension in the area, but also bringing that increased blood flow to the area. So a lot of times if I'm explaining clinicians on the usage of it, a lot of times I'll go into that dosage with how, low versus high dosage can affect the patient.
Yeah, I love that you brought that up too, because I think there's just like such a spectrum of how patients tolerate the dosage of needling and like the different techniques that you can implement, like the pistoning versus like the the internal stretch. So like, twisting the needle around a muscle fiber and actually pulling it up to stretch, as well as adding the addition of like the NMES or the TENS to it. Like everyone just responds so differently. Me personally, I feel like I tend to underdose people a little bit before I kind of go right after them, just because I want to make sure that they feel comfortable with it. Because like kind of like what you said, Andrew, like there's so many like chemical factors and like those sympathetic responses that you get from the dry needling. So just making sure that they're comfortable with it before diving in is great. And like I love the patients that are just like, yeah, like let's like get right to it. Like we'll kind of really get after it, like give me what you got kind of thing is almost like kind of a fun way to put your technique and skills to the test, because there's such a wide variety of things you can do with the dry needling with the proper training. So it's great.
Yeah, no, I agree. And you mentioned it there is such a wide spectrum of treatment options, from, musculoskeletal conditions to neurological conditions to, you can even needle the face for things like sinus pressure and headaches. And so the list of treatment options for dry needling really encompasses a vast array of treatment options. So, for clinicians listening out there who think, they're on the fence about, is this something I want to, look at and use as a treatment tool or option? And if you're looking at it like, well, the standard myth of dry needling is, it's just for, the sports population, or it's just for trigger point therapy. It really goes much deeper and further than that. So, I encourage those interested in it, do a little background and education on it, but it is a really highly effective treatment for a really big scope of conditions.
Yeah. I have a patient right now who's 94, who I do dry needling for, and she absolutely loves it. Yeah. She is amazing. And she actually she's from China, and she asked if it was acupuncture. She was like, "Oh, you do acupuncture?" And I was like, "Nope, this is different." So we had to go through the whole spiel, and we did it along her IT band, and she got up and she was like, "Oh, this is great." So that was kind of a fun experience, and she'll probably be the oldest person I will ever do, but we'll see. But it was really cool to see.
That's awesome. Thank you both for sharing. And so, kind of sticking with that similar theme, I would love to hear from everyone how Ivy has played a role in your continuing education journey, especially when it comes to dry needling and how they've supported you.
Yeah, I'll start. So Ivy was completely on board with me taking these courses, and for me personally, it fell at a time where I was opening up a new clinic in the South Jersey area, and in our area, we were doing our research. There, at the time, wasn't very many clinicians who offered this treatment. So for us and for Ivy, looking at it, we said, well, it's a way that we can sort of find a niche and offer this and market it to referral sources that's not readily available. This is going back a few years. As things do, it's catching on very quickly, and a lot more clinicians in the area are utilizing it. But in terms of the continuing education aspect, it was just full send. There was no questions asked. They said, yeah, absolutely, go for it. I completed mine in a very short duration of time. I think my first course was November, and then I was credentialed in January. So
Wow.
it's not always that quick with just where the courses are offered and the distance you have to travel. But I have to say, from the very beginning, Ivy was very supportive on the continuing education aspect and allowing me to get it in such a quick manner.
Yeah, I was the exact same way. Like, I think I started mine in August and I finished by November. And like I mentioned before, even though PA was a gray state, like they were completely on board with me just getting credentialed and just getting that education out there. And in a couple more months after that, then I was dry needling patients in the clinic, and it was great because I felt like a pioneer, and Ivy really helped me with that. So it was awesome.
Oh, I love your passion, guys. I can speak to it from a global company perspective. It is definitely something when specifically the New Jersey kind of bill was passed, we kind of doubled down on making sure that we were doing things right, not only in New Jersey, but across Ivy, and ensuring that we had, resources for clinicians to go onto our, we call it an intranet, where everybody can get their information, and just make sure that they understand that there is state by state variability, and there is education requirements that each state it is your responsibility as a clinician to know this. And we wanted to come in and make sure we supported our clinicians in that. So a lot of what I do in my day-to-day job is support clinicians that might be like Vince or Andrew, want to start out and get this certification and don't know where to start. They're great examples of getting it done quickly. That is not always the case, but clinicians come to me all the time, and that's the situation, right? Hey, I'm looking to be dry needling certified. I want to do it quickly and I want to do it compliantly. Like, how can you help me? And that's what we're here to do, is to guide them through that, to help them interpret, their state practice act. Because speaking to all the clinicians out there, it is absolutely something that you need to understand. You need to understand the legal scope. You need to understand the education requirements. It is, it's not universal. So what your friend is doing, your old classmate is doing, is not necessarily what you're doing. It's also super important to know that not every education provider is created equal. It is your responsibility as a clinician to look at the education provider details and ensure that it meets your state practice act, and ensure that that certification and those CEUs and everything that you're doing meets the requirements that you're practicing in. So that is my compliance spiel to those who are listening. And I think it's just really fun for me to be able to mentor clinicians at Ivy, and for our team to be able to provide that support in a world that we just talked an hour about, a confusing, world. So
Thank you so much, Kara and Andrew and Vince. Those were phenomenal answers, and I hope everyone is taking notes out there because this is valuable information. But we are nearing the end, so I will close off with our last question. For clinicians tuning in, what's one thing that they should walk away remembering about dry needling and their role in advocating for their scope of practice?
Yeah, I would say just, if you're going to pursue dry needling, just know that you are taking steps to practice at the highest level of your scope. Like, I think that just adding this to your toolbox is just making you that much more better of a clinician, and just having you gain more of an understanding of what we can do.
Yeah, I would echo that sentiment in that the training you get, and I'll speak to New Jersey because it's the state in which I practice in. The rigor in which it requires to get certified in dry needling in New Jersey requires a significant amount of didactic and lab hours. So in that time, I feel like you come out as a far more advanced clinician, knowing the body and the neural pathways and the different ways that you can use this treatment option to help patients. But as Vince said, the sort of wide array of patients that you can treat using this technique, I think, just elevates your skill set as a clinician. So.
And I would like to tell everyone out there to be the best clinician you can be. And always, always, always keep patient safety and professional integrity at the center of your practice.
Thank you so much, everyone. That concludes today's episode of Clinically Speaking. Thank you, Kara, Vince, and Andrew again for being our guests today. And for anyone thinking about joining Ivy, please email recruitment@ivyrehab.com or comment below. We will see you guys Thursday, August 21st at 5 p.m. for our next episode. Bye, everybody.
Thank you, guys.
Thank you.
Bye.